Good day, my name is Corlius Burkle and I'm the CEO of Zavant Technology. Today I have the privilege of sharing with you how we believe that our StimPod NMS460 may impact hugely on saving lives of patients who develop life-threatening respiratory distress related to COVID-19. Our vision at Zavant Technology is to create electromagnetic cures that target the biological root cause of disease states, increasing treatment efficacy whilst eliminating side effects. The leading hypothesis regarding the rapid onset of respiratory distress syndrome because of COVID-19 complications involves an overreaction of the immune system towards the coronavirus, better known as the cytokine storm. Cytokines form an important part of the body's inflammatory immune response, and when a balanced cytokine response is elicited, healing occurs. However, an unbalanced cytokine response leads to a hyperinflammatory state causing tissue injury. In the case of COVID-19, this tissue injury occurs mainly in the lungs, but often also in other major organs. In engineering terms, the control system which regulates this immune response to COVID-19 intimately involves the vagus nerve. Zavant Technology has developed a proprietary waveform which has a very unique impact on the nervous system. The FDA-approved indication for the NMS460 addresses another body survival control system known as neuroplasticity, which when it overreacts can turn a normal nerve with a healthy nociceptive response into a neuropathic nerve, which leads to very difficult to treat disease states such as neuropathic pain. The efficacy of our proprietary waveform impacting positively on such disease states have been proven objectively. Similarly, the effect of applying our proprietary waveform on the vagus nerve has anecdotally demonstrated that our waveform has an effect on regulating the control system relating to it. This includes the cholinergic anti-inflammatory pathway which regulates the body's cytokine immune response. In a nutshell, we believe that the Zavant NMS460 has the ability to biohack the control system regulating the body's cytokine immune response. As a non-drug neuromodulation solution, we firmly believe we can treat the life-threatening symptoms of COVID-19 in a targeted manner, treating the cause of the disease and with no side effects. One of the world-renowned academics that we've had the privilege of working with, Professor Andre Bozard, will now provide the scientific background on at least two mechanisms that we believe relate directly to the way in which the Zavant StimPod NMS460 device may impact positively on the symptoms related to COVID-19. I thank you.
My name is Andre Bozard. I'm a professor emeritus from the University of Florida, currently residing in South Africa. The topic I would like to discuss today is the cytokine storm associated with COVID-19 infection and how to manage it with neuromodulation, more specifically transcutaneous auricular vagus nerve stimulation. So, let's dig right into it. According to Garija and his colleagues in their 2020 paper in the Frontiers of Immunology, the SARS-CoV-2 disease progresses through 4 stages. The first stage is the pre-symptomatic stage, which may lead to fever, cough, generalized malaise, and a high viral load. This is followed in stage 2 after 7 to 10 days with a viral pneumonia that involves the lower respiratory tract, while the viral load in the upper respiratory tract decreases. The vast majority of patients show clinical improvement as protective immune responses are developed at this stage. During stage 3, a minor proportion of patients develop symptoms of hyperinflammation, the so-called cytokine storm, characterized by exaggerated levels of pro-inflammatory cytokines, which I will explain in a minute. Finally, stage 4 marks the onset of acute respiratory distress syndrome, or ARDS, and multi-organ failure with a 70 to 90% mortality. Let's first look at normal inflammation and what cytokines are. Cytokines are proteins released by specific natural defense cells called macrophages and other immune cells. If the cytokines are unbalanced, they cause tissue damage and disease syndromes, or, on the other hand, tissue recovery if they are balanced. The balance of the cytokines naturally takes place via the so-called cholinergic anti-inflammatory pathway, or CAP, which is regulated and controlled by the vagus nerve. The vagus nerve is the parasympathetic part of the autonomic nervous system. The other part of the autonomic nervous system is formed by the sympathetic nerves, and these two have to be in balance to maintain good health. The vagus nerve, the longest of the cranial nerves that goes to the head, neck, thorax, and abdomen, has fibers that go to the brain, and these fibers are called afferent fibers. These fibers have cytokine receptors. In other words, they are sensitive to cytokines and take messages to the brain about the status of cytokines or inflammation in the body. In the case of COVID-19, to the brain from the lungs. It also contains fibers that come from the brain to the body, where it, by the cholinergic anti-inflammatory pathway, inhibits cytokine release and thus balances the cytokines and causes tissue recovery. Electrically stimulating the vagus nerve with very specific electrical waveforms enhances the messages that go to the brain and also the messages that come from the brain that go to the lungs in the case of COVID-19, where it enhances the cholinergic anti-inflammatory pathways. There are, of course, also drugs like dexamethasone, amongst others, that also does this, but these drugs also suppress the rest of the body's defense systems and thus promote other dangerous infections like bacterial and fungal lung infections. Electrical stimulation of the vagus nerve, called neuromodulation, has no effect on the rest of the defense system and in fact has no unwanted side effects at all. Vagus nerve neuromodulation affects the COVID-19 infection by enhancing the cholinergic anti-inflammatory pathway and thus preventing or uptunding the cytokine storm, and is in fact the most potent anti-inflammatory agent known to us. It also, via the vagus efferent to the lungs, causes widening or dilatation of the constricted lung tubes called bronchioli, which is another big problem with COVID-19 infection. Where can we stimulate the vagus nerve? Since the 1980s, doctors have been stimulating the vagus nerve directly in the neck by placing an electrode around it surgically. This was used and is still used for drug-resistant epilepsy and also drug-resistant depression. But since 2011 in Europe and 2017 in the USA, non-invasive or so-called transcutaneous stimulation of the vagus nerve without surgery in the neck has been approved by the European and USA authorities for migraine treatment and the treatment of major depressive disorder. Traditional practitioners of Chinese medicine have known for thousands of years that you can stimulate the vagus nerve via the concha of the ear. The vagus nerve has two nuclei, a superior and an inferior nucleus. The superior vagus nerve nucleus has a branch that goes to the concha of the ear, the so-called auricular branch of the vagus nerve. The inferior nucleus gives rise to the cervical vagus nerve in the neck, An abundance of reputable scientific work using sophisticated modern research methods such as functional MRI has convincingly shown that electrically stimulating the vagus nerve in the ear has exactly the same effect in the brain and on the cholinergic anti-inflammatory pathway as cervical vagus stimulation in the neck. Work published in 2020 by Yin and his co-workers showed that auricular electrical acupuncture successfully treats the inflammation of the novel coronavirus pneumonia. Transcutaneous vagus nerve stimulation has also been used by Peter Startz and his colleagues in California in 2020. They showed rapid improvement in patients infected with COVID-19. We currently have the theoretical knowledge supported by solid scientific evidence that transcutaneous auricular nerve neuromodulation has no unwanted adverse effect and, although not supported by targeted randomized controlled trials yet, will almost certainly control the cytokine storm that is responsible for progressing COVID-19 from stage 3 to stage 4, can thus prevent the progression of the disease to where patients develop ARDS and require mechanical ventilation. There is no downside to offering this mode of treatment to patients with stage 3 COVID-19 infection or even to patients with stage 4 COVID-19 infection. I thank you very much for your kind attention.